Hey everyone, Drew Hinton with Aero Safety back again to talk more about respiratory protection. So hopefully you've turned into the previous videos I posted, but today we're going to talk about respirator fit test. And we're specifically going to focus on the requirements before administering the fit test. And then we're really going to focus on the actual exercises you're doing, the test exercises for the fit test. Because what I've seen with a lot of customers and clients and across the industry, from construction industry to manufacturing to chemicals, whatever it may be, is there are a lot of areas within the test exercises that we're missing on, and we're missing those small points. Maybe they seem small to us, and maybe we think they're not a big deal, so we just skip that step, or maybe we're just not aware of the standard. And so I want to bring that to your attention. I want to bring that to light, help us understand what the requirements of OSHA's respiratory protection standard are, and then help you understand the proper process for a respirator fit test. And so we're just going to jump right into it. The first thing we want to understand is what's a fit test. And so a fit test is going to, no matter what type of respirator you're using, it's going to determine how well this respirator is going to fit to my face, and it's going to determine if it's going to provide adequate protection. So there are a couple different types of fit tests, whether it's a qualitative fit test, if I'm using isoamyl acetate or Bitrex or my saccharin solution aerosol, irritant smoke, whatever it may be, or if I'm using a quantitative fit test with a TSI port count or an OHD, a lot of different options there. But a fit test is going to make sure that specific mask is going to fit my face and provide an acceptable amount of leakage, which brings us to our next point is, okay, I've got this respirator, I've done a fit test, it's passed. That means there's no leakage, right? Not quite. So I'll go on air. You can quote me, whatever you want to do. Every respirator will have leakage. No matter what type of respirator it is, no matter who you are, there will always be leakage. What these fit tests are doing is making sure that your leakage is at an acceptable rate. And so unless you have this mask that's made specifically for you, it's custom made for you that day, you don't have any facial hair growing since it was made, no sweat, anything like that, and it was a custom made mask for your face, unless that happens, you're going to have leakage, because that's not the case for most of us. We don't have a custom made mask. It's mass produced. This respirator is going to fit my face, but I have a limit that I have to stay under on my leakage. And so some respirators, you got to stay under a fit factor of 100. Some of them you have to stay under a fit factor of 500. And so understanding what type of respirator you use, when a fit test is required, what a fit test is, those are all things we're going to discuss. So we just mentioned a fit factor. What is a fit factor? And so a fit factor is a result that's going to give you from your fit test that compares the ambient concentration of a substance in the outside air versus the ambient concentration, or the concentration of that substance inside your respirator. So it's going to compare outside the mask versus inside the respirator, and making sure that that fit factor is at the acceptable limit and have the least amount of leakage as possible. And so I've talked about what a fit test is making sure that it's going to fit my face. I've talked about what is a fit factor. And one point that you want to make sure, I think most everybody's got it under control, but I just want to bring it up just to make sure, is you have to do a fit test on the same make, the same model, the same style, same size, and the same style of respirator that you will be using. And so right now I'm using a 3M 6200 medium air purifying respirator, half face air purifying respirator. And my cartridges on here are a 3M 60923, which means it's for organic vapors, acid gas, and particulates, P100s. And so if this is a mask I'm going to be wearing, this is the same exact mask respirator I'm going to have to wear during my fit test. Now, one thing you'll want to make sure, if you're doing it in-house, it's one thing. You'll also want to check on this, but especially if you're sending somebody out to a medical facility to do these fit tests, you want to make sure that they have the appropriate fit test adapter based on whatever type of mask and respirator that you have. And so don't always assume that they have that adapter, because there are hundreds of them out there. And so you can call ahead. Sometimes they do. If it's a common one, they may have it on hand just because maybe they do it quite a bit. But if not, you may want to give them a few days to order that or get one rented, whatever it may be. But there's a fit. Basically what it is, it's an adapter that's going to go in between one side of your respirator. It's going to screw into my respirator, and then I'm going to put this cartridge on top of that adapter. And what that's going to allow you to do for a quantitative fit test is allow me to attach my tubing and get a reading to determine my fit factor. And so we're talking about these qualitative and quantitative fit tests. So what are these differences? What's these two terms that are thrown around? A qualitative fit test is a fit test that is based on the user, the wearer, the person wearing the respirator, based on their response to a test agent. And so when I say test agent, we talked about a few of them earlier. You have your isoamyl acetate, you have your saccharin solution, you have your irritant smoke, your Bitrex, a few others. So what their response is going to determine whether they pass or fail. That's the big thing is with a qualitative fit test, it's a pass or fail. There's no in between. So you either pass, you don't detect the test agent. So some of these are going to have you're going to be able to smell it. Some things are going to be able to taste it. If you're doing the irritant smoke, you're going to cough. That's the whole point of it. It's going to produce that coughing reflex. And so if you produce that response, so if I'm using irritant smoke and I cough, I've unlikely failed that portion that fit test. And so it's a pass fail. There's no in between. There's no you did okay. It's either you pass or you fail. That's it. So that's a qualitative fit test. Quantitative fit test with an N, on the other hand, is going to be used with certain types of respirators, and you're going to use a TSI port count. You can use an OHD, a lot of different models out there that you can do a quantitative fit test. But that's going to give you an actual number, and so it's going to compare that ambient concentration of the substance that's outside your mask to the concentration of that substance inside your mask. It's going to give you that number. And so again, depending on the type of respirator you have, depending on the hazard you have, and depending on the levels of that the substance you're being exposed to, is going to determine what type of fit factor you have to have. Some things are going to be a fit factor of at least 100. Some things are going to have a fit factor of at least 500. So you'll need to refer to your site-specific hazard assessment to determine what you're dealing with. You're going to refer to your manufacturer's guidelines from, if I'm using my 3M respirator, I'm going to refer to 3M. If I'm also going to have to refer to OSHA's 1910-134, the respiratory protection standards. So their Appendix A is going to give you all these fit test guidelines and the mandatory guidelines, I should say. And so we've talked about what is a fit test. We've talked about what is a fit factor, the different types of fit tests, so your qualitative versus your quantitative. Now we need to say, who can do this fit test? Who can administer the fit test? So can I just have my HR person or my safety person or my plant manager, whoever it is, can I just have anybody come out and do a fit test? Yes and no. And so OSHA is pretty gray on this area to an extent. And so with the qualitative fit test, so again, with dealing with isoamyl acetate, the saccharin solution, Bitrex, whatever it may be, if I'm doing a qualitative fit test, OSHA does not come out and specifically say what qualifications that fit test administrator has to have. However, as a best practice, you're going to want to document the training. So whatever training you go through, you can do anything from going to the manufacturer's website on the fit test. So if I'm using an Allegro fit test kit that has Bitrex or irritant smoke, something I've used previously, if I'm using an irritant smoke test kit, I can go to Allegro site, or I can go to YouTube and look at some videos that'll show you how to do that. Or I can sit there and read through the user's instructions. It'll walk you through step by step how to administer that fit test based on the test agent you're using. But whatever training you do, you want to make sure it's documented, because just like everything else, if it's not documented, it didn't happen. So make sure you document that training, that you've been trained on the procedures for that qualitative fit test. Now, quantitative fit test, on the other hand, is a little bit different. And so quantitative, they do have a few qualifications for the fit test administrator. So they're pretty basic, but you've got to know how to calibrate the fit test machine. So whether I'm using that TSI port count or I'm using the OHD or whatever other model you want to use, I have to know how to do the calibration when I first started up and do the daily checks on it. And then basic maintenance. And what I mean by basic maintenance is figuring out what's going on with the power supply, or if there's the tube I have to put into the solution of alcohol to get it to work right. Basic maintenance on that. I'm not having to figure out how to do the annual certification for the maintenance on it or tear it down, anything like that. But I do have to know how to do the basic daily checks on it. When I'm getting ready to do a fit test, I have to know how to do the basic daily calibration, the daily quick checks to make sure it's working properly before I administer the fit test. And so again, qualitative fit test, really can read the instructions from the user's instructions from the manufacturer. I can watch videos from the manufacturer, make sure it's just a reputable source. You don't want to go on YouTube and find a source to where somebody's just talking about how to do a fit test and they leave out all the steps. You want to make sure it's a reputable source. So if I'm using an Allegro I'm just using them as an example because I've used them in the past. If I'm using Allegro irritant smoke solution, I want to make sure it's preferably a video from Allegro showing me how to use that. And so again, making sure it's documented whatever way it is. Now again, there are courses out there that can show you how to do that. If you want to go ahead and do that, that's great. That provides you more documentation that you're qualified. But on the quantitative side, you have to know how to calibrate it and do your daily checks. So a couple of different things there. Now, training on the respirator use. So if I'm getting ready to do a respirator fit test, that's not the time to do a formal respiratory protection training for that user or that person wearing the respirator. Now, if I want to do it beforehand, sure, I can do that. But ideally, when they're talking about specifically, if I'm just calling somebody and say, hey, it's your time for your fit test, come on in here, we'll do it. That's not the time to do it. But what I can do is I can show them, I can do it should be a refresher, should be just a quick review. It's not a formal. I can take the respirator that they're using, I can show them how to put it on, I can show them how to take it off, adjust the straps, do their quick user seal check, whatever it may be. But again, it should just be a refresher or a review. If I give them this respirator and they look clueless, like they've never seen this thing in their life, you probably should wait and do that fit test at a later date once they've gone through some formal training. Now, one thing you're also required to do, which we talked about in another video, is you're actually required to give them multiple models and styles to where they can get a respirator that fits them properly. And so when they're doing this fit test, one of the things you have to do at the end, and we'll discuss that here again later, is one of the things you have to do after the fit test exercises are completed is ask them how it feels. If they get done with the fit test and they say, it feels terrible, it's really tight, it's hurting, it's irritating me, whatever it may be, then they have the option of choosing another mask and doing a retest. And you have to give them that option. And so understanding what the difference between a formal training is, which should be done prior to the fit test, and then the refresher. So you can give them a mirror or somewhere they can look at themselves and adjust it to make sure it's fitting properly, show them how to do their user seal checks. But it should just be a quick refresher, a quick review, should not be a formal training. So we talked about the training with the fit test administrator, we talked about the training for the person wearing the respiratory protection. So now we need to look into what has to happen before I can do a fit test. So one, we just talked about training, formal training, but also your medical evaluation. So we talked about that the other day in the other video. We're not going to talk about it and go too much in depth with it, but you have to have that medical evaluation by your PLHCP, your physician or other licensed healthcare provider has to give them a medical evaluation, make sure they're medically fit and medically cleared to wear the respirator that they're going to be wearing in their job duties. And that's one thing you have to make sure that the PLHCP is aware of, is make sure you're letting them know what their job duties are, the type of stress they're going to be going under, physical, mental, psychological, and then also the type of respirator they're going to be using. So it helps if they're going to be going for that medical evaluation, send the respirator with them so they can get a better understanding. And so looking at the training, we're going to look at making sure that they're properly trained beforehand, do a quick refresher, and then we can kind of give them a general rundown of what the test exercises are. And so we don't want to be explaining it to them as you go, because you're going to be losing that. You're going to have that delay during the process, and you're not going to get an accurate reading. So you want to explain the whole process of the fit test procedure beforehand. So we're going to explain the different stages of the fit test, the different exercises, tell them when they should do certain things, when they shouldn't do certain things. And then what I always do as a best practice is I pull if I'm doing a quantitative fit test, if I'm using a TSI port account or something, I will pull it up on a screen to where they can see what exercise is coming up next, and they can see the timer so they can know when to expect it. So that helps them kind of prepare for what's coming up next. That way you have that smooth transition from going to, let's say, exercise 1 to exercise 2. They're not fumbling around and trying to figure out what the next step is. They already see what's coming up, and as soon as that timer hits 0 to start the next exercises, then they know that what to go into. And so looking at that, we're going to show you different videos here that will break down the different types of exercises. And I'm going to point things out, again, that maybe some people are not aware of. Maybe you are, and that's great. But some things that I have seen customers, clients, and people in all types of industries look over and maybe misinterpret or misunderstand. But one of the first things you're going to do is, once they figure out what type of respirator they want to use, is have them put that respirator on for 5 minutes prior to doing that fit test. And that is a requirement from the OSHA standard, is to have them wear that respirator for 5 minutes prior to doing the fit test. And that's going to do 2 things. So one thing, the first is going to be it's going to apply to qualitative and quantitative. But the first thing is going to make sure that they're comfortable wearing that respirator. And so if they're not comfortable wearing the respirator after 5 minutes and they say this doesn't work, it's too tight, it rubs my skin too much, whatever it may be, then you're not wasting your time doing a fit test. They can take it off, try another style or another model. But the second thing that applies specifically to the quantitative fit test is what it's going to do is it's going to allow you to purge and get rid of that contaminated air that's inside that mask. So when I grab this respirator and I put it on, there's contaminated air that's kind of just trapped in here. That's stagnant air that's kind of just trapped in here. So 5 minutes of breathing will allow me to purge that contaminated air out of the mask, out of the respirator, so I get a proper reading once I'm doing my actual fit test. I get a proper fit factor and a proper evaluation. So we'll take a look at the steps here, and we'll look at the different exercises. I'm going to show you the proper way to do that. I'll point out some tips and tricks along the way.
One 99, 98, 97, 96, 95, 94, 93, 92, 91, 90, 89, 88, 87, 86, 85, 84, 83, 82, 81, 80.
All right, so hopefully that explained the fit test procedures and the test exercises a little bit more for you. There are a few things I do want to cover and go over before we close this video up. I want to go over a few things that stick out to me, the things that I've seen in my experience that definitely need to be addressed. And so one, OSHA specifically says that the fit test shall not be conducted if there is any hair growth between the skin and the sealing surface of the face piece. It does not say, a 1/4 inch of hair growth is acceptable. It does not say, this type of facial hair is acceptable. It says it shall not be conducted if any hair is present between the skin and the face piece sealing surface. And the reason for that is, the way I explain it to a lot of people is you can potentially a lot of times pass a fit test if you have facial hair. I've got a little bit going on right now, but if you have facial hair and you do a respirator fit test in a cool, controlled environment while you're not stressed out, you're not sweaty, sometimes you can pass that test and not have a big issue. But it's when you're actually sweating and you're out there doing the strenuous work, you're bending over, you're looking around, you're doing the work that you're normally doing your daily routine. That's when that mask will start sliding around. So that's where that facial hair comes into an issue. Now, of course, when you start getting the excess of facial hair, people's got big goatees and big beards and really thick mustaches that will push out on your respirator. Of course, that'll cause an issue. But people think that maybe well, I've just got a little bit of stubble, it's not a big deal. During the fit test, sure, there is a possibility that during the fit test you can pass the fit test with a little stubble and a little bit of beard growth. But it's when you're actually using the respirator in that regular, whether it's routine or emergency situation, it's when you're actually using that respirator and you're sweating, you're doing the strenuous work, that's when it's going to start sliding around. And so no stubble hair, no stubble beard growth, no beard, no mustache, no sideburns, anything that will interfere with that face piece of ceiling surface. Now, if you just have a mustache that does not come down to the, if you're wearing a face piece and it just, and the ceiling surface goes around here and your mustache does not come down there, then that's fine. But if it comes down here or you get sideburns or beard that gets in the way of that ceiling surface, that is not acceptable. I know some companies that will do fit tests and they'll make a note on there. They'll still pass them and they'll say, note, this person had stubble hair. Per the OSHA regulations, you're not allowed to do a fit test with any facial hair growth. And in addition to that, on a similar note, it's actually in the same place within the standard, is any type of apparel or PPE that's going to potentially interfere with your fit of your respirator while you're wearing it is going to have to be worn. And what I mean by that is, if, let's say, you're a construction worker, you're getting a fit test because you're going to be dealing with crystalline silica. If you're wearing a hard hat all day, you're going to have to wear that if you're wearing a full face respirator. And so, that may potentially cause your respirator to slide around, cause issues. So you want to wear that to make sure it's not going to cause an issue. Same thing with fire departments. Firefighters are wearing their helmets with their full face SCBA. They need to wear their fire helmet during their fit test as a requirement of the OSHA standard. So no facial hair that impedes with the ceiling surface of the respirator. Any kind of PPE or apparel that is going to be worn, whether it's bump cap, hard hat, fire helmet, whatever it is, if it's going to be worn while you're wearing that respirator and it may cause an issue with that respirator's fit, you have to get fit tested with that on. So another point I want to bring up is if you're a fit test administrator or somebody conducting the fit test and you notice that somebody is having difficulty breathing during their fit test, go ahead and stop that test. Go ahead and stop them or refer them out to a PLHCP. Go ahead and get them medically evaluated to make sure everything's okay. Because you definitely don't want somebody passing out during your fit test. So you want to stop the test, refer them out to a physician, some other kind of licensed healthcare provider, and determine whether that person is physically fit and medically cleared enough to wear a respirator. And then a couple things we want to close up with. So when you're wearing the respirator, once it's on, once you're doing the fit test, you cannot touch that respirator. You cannot adjust the straps. You cannot position around your face. You cannot touch that respirator once your fit test has started. If you started that fit test and they say, well, it's hurt my nose, it's rubbing my face, pinching something, I got to readjust it, you have to stop the test, let them do their adjustments, and you have to restart from exercise 1. And so that's a really big point. That's probably one of the bigger things that I see is, they'll continue with that test while they're adjusting their respirator. That just voids out the results. You have to stop the complete fit test, let them do their adjustments, and then start over from square one. So making sure that nobody's adjusting that. And then after they have conducted the fit test, you have to make sure that everything felt comfortable, they felt snug, it felt fit for them. Whenever the fit test is completed, you have to ask them, as a fit test administrator, conductor, you ask them, was it comfortable? Did it fit? Did you have any issues? If they say, yeah, it was really tough, it was really pinching my nose or pinching my cheeks, it didn't feel comfortable, they have the option to choose another respirator and then get retested. Now, if they pass the fit test, even though it was uncomfortable, if they pass the fit test and they say, oh, it's not a big deal. Yeah, it was uncomfortable, but it's not a big deal. I'll just use it anyways. That's their option. They can do that, but they also have the option of choosing a different respirator that may fit better and may cause a better seal. So make sure you keep that in mind as well. Now, one thing you did not see during the test exercises before is exercise number 6, which is the grimace. And what the grimace is it only applies to quantitative fit tests. It does not apply to qualitative fit tests. So if you're using a port account, you're using an OHD, some kind of quantitative fit test machine, that's where the grimace will apply. And basically the grimace is, rather than 60 seconds, you're going to do 15 seconds of continuous smiling or frowning. But you're going to do a grimace for 15 seconds, and that is only going to apply for the quantitative fit test, not the qualitative. And one thing that you want to do, especially if you're the one administering the test yourself, is make sure before you do that fit test, you go into those settings in your fit test machine, whatever model you're using. Go into those settings and make sure that grimace is going to actually work, and that it's actually going to do that portion of the test. Because a lot of times, if you let's say you rent a fit tester from somebody, from a third-party company, or you send them out, a lot of times that exercise number 6, the grimace, will be excluded because they normally do qualitative fit test, and so they won't think to go back in there and check that box to make sure it's going to do that. So make sure that if you're doing a quantitative fit test, you are checking that box, you're changing those settings to where it does include the grimace. If you're not sure if it does it or not, you do a fit test. When you print out that fit test report, it will say excluded on there. And now, one thing I want to recommend as a best practice, you don't have to do it, but I'd recommend it as a best practice, is if there is a setting, I'm just using TSI port account as an example because I'm familiar with it. I've used it several times. But if there's a setting in there to where you can go and have the test automatically abort or stop, if it detects that there's no way that person's going to pass the test, that it will automatically stop, go ahead and do that. Save yourself some time. Save the fit test, the person wearing the respirator, save them some time. And what that does is, if let's say they get through exercise 1 of normal breathing and they fail it, and then they get to exercise number 2, the deep breathing, and they fail that one, and they fail both of those so horribly, and that the fit test machine will determine that there's no way that person can possibly pass, even if they've passed the rest of the exercises, it will automatically stop the test and say that it's failed, that there's no way they can pass. Like I said, go ahead and save yourself some time, save the person wearing the fit test some time, rather than getting all the way to the end and saying, okay, you failed all 8 stages miserably, now we got to do it again. Go ahead and save some time and check that setting off to where it will automatically abort and quit the test if it detects that it won't be able to pass. And so, again, exercise 1 is you're going to do normal breathing. Just simply tell them they stand there. They have to be standing in a standing position. That is, as stated in the OSHA regulations, is in a standing position. They're going to do normal breathing. Exercise 2, they're going to do deep breathing. So deep breath in, deep breath out. Exercise 3 is going to turn their head side to side. And as you've saw in the video, they're going to inhale at each extreme. So when they get to each side, inhale, and then they're going to exhale when they go across. Get to the other side, they're going to inhale again, and for the full 60 seconds. And then test exercise 4, moving up and down. They're going to inhale at the top when they're looking at the ceiling. Exhale when they go back down, come back up, inhale again. And then number 5, that's the one that probably I see more people kind of, I guess, botch, if you want to call it that. But the one where they're supposed to talk in a loud manner. And so some people are only familiar with the rainbow passage, and they think, well, this rainbow passage, let's be honest, this rainbow passage is kind of a fruity thing for an adult man to say, or anybody to say. But what it's doing is it's trying to hit all the syllables. It's trying to make your facial expressions hit all the different syllables. That way, if it's going to leak, it's going to detect it. So, but you also have the option of counting backwards from 100, and that's usually what I have my users, my respirator users do, is I'll say count backwards from 100 loudly where I can hear you. Because a lot of times you'll get somebody that'll wear the respirator, so not only now that you're wearing the respirator is your voice is muffled, but now they're going to talk really low. It's rather than 100, 99, 98, they're going to go 100, 99, 98. And I know you can still hear me on the video, but just imagine a respirator being on me. It makes it difficult to hear. And so all these exercises are simulating what you're going to typically be doing while you're wearing a respirator. So just standing there, deep breathing because you're doing strenuous labor, looking up, looking down, looking left, looking right, grimacing, bending over, picking something up, whatever it may be. And so there's a lot of fine print that many fit test administrators or fit test conductors are not aware of. Maybe it's stipulations that if you can't do this part of this exercise, then you have the option of doing this one. Like I just mentioned with the rainbow passage, most people are only familiar with rainbow passage, but you have the option of counting backwards from 100 or reciting, a poem or a song that as long as you're doing it loud and clear to where the fit test administrator can hear you. And then making sure, again, you're wearing the PPE or any kind of apparel that may interfere with your fit. And so once you're done with that, you're going to print off your report. You're going to have the fit test administrator or conductor, whatever you want to call it, the person conducting the fit test, have them sign it. If it's passed, you're going to have the person that was fit tested, the test subject, you're going to have them sign it as well, and you're going to want to keep those on file. And these fit tests are required every year at a minimum. Let's say you go 12 months and nothing changes, then you'll do your annual fit test. But let's say you're using Scott respirators, and then 6 months later you change everything over to 3M, or you change everything over to MSA, or whatever brand you want to use, but you change your respirators. You have to do another fit test, and then your 12 months starts then. So you'll do your fit test on your new style of respirator, and then your 12 months starts until you got to do your annual fit test again. And so hopefully this was able to provide you with some beneficial information. I know I didn't cover everything. Like I said, I didn't want to get into all the specifics of the fit test machine because there are so many different models and they all operate a little bit differently. But I wanted to really go into the test exercises themselves, making sure you understand those test exercises and all the stipulations that you have to go into, as well as the alternative options that you may have on some of those different exercises. So hopefully it brought you some more knowledge. Again, if you have any other questions, feel free to go to our website. I'll put that up here at the bottom of the screen right now, www.aerosafetyus.com. And if I can help you out in any way, whether it's a question with the respiratory protection program, it's a question about fit testing, feel free to contact us. I'll be glad to help. Thanks again. Have a great day.